This is the Dr. Berg Show. Live from the nation's capital, it's time to get healthy, lose weight, and feel great. Call now to speak with Dr. Berg at 866-561-4292. And now, Dr. Eric Berg.
Hey guys, we're back again. Welcome. We have Karen over here.
Good morning.
And today we're going to answer your questions. Already have a ton of questions, but if you want to call in, the number is 866-561-4292. And again, anything that I say is not meant to diagnose or replace your medical care. It's just meant to give you more information so you can do research and work with your doctor to, come up with a better plan. All right, good. So there's quite a few callers. We're just going to jump right in to the first one in Atlanta. Shayna, go ahead. You're on the line.
Hey, Dr. Berg.
Hi.
Hey, Karen. Hope y'all having a good day. Hey, beautiful. Dr. Berg, thank you for taking my call. I have a numbing on my right side from my hip down for about 8 days now. When you touch it, it's like a tingle and ticklish feeling. I feel like weakness in my right leg. I can't feel hot or cold on my right leg. About 2 weeks ago, I had like an EMG done on my left side that came back normal from a previous issue with numbing and burning sensation that went away after you told me to take nutritional yeast.
Mm-hmm.
I want you to know, Dr. Berg, that I eat one meal a day as you prescribe, like the 7 to 10 vegetables, the fat, everything how you prescribed it. I take 6 of your nutritional yeast pills plus 2 tablespoons of the powder form that you recommend, and I've got no relief at all. Can you please help me?
Yeah, so they did a nerve conduction test on your right side, but not your left?
They did it on my left side, but not my right side.
They should probably do it on the right side, since you have the problem on the right.
No, it was on the left side at first, but when you told me to take the pills, it went away. So at first it was the left side.
Okay.
I never, ever had problems on my right side, ever.
Okay, so here's a couple tips. You ready for this?
Yes, sir.
Are you sitting down?
I am.
Okay, so there's a chance that you have a pinched nerve in your back, in like maybe L4, L5, and that's always a chance because, we can do all these different techniques, but if there's actually a little tiny protrusion, it's not going to go away. But usually when it's numbness, it's a nerve pinch. But before we just assume that, you can get an MRI and just check it out. X-ray doesn't really show the soft tissue. But here's something you can do just for the fun of it, and you can try this. If you have numbness on the right leg, okay? Now realize the sciatic nerve goes on the back part in the hamstring, way deep down there. So a lot of people have it on the side. That's a different nerve. It's not the sciatica, and that's usually could be a pinch there. But here's what I want you to try. I want you to try doing massage on the opposite mirror image part of the leg. So you just massage on the opposite side with the numbness and just work on that and see if it doesn't improve your numbness. If it doesn't and this thing persists, you're going to have to get a further test because there's probably a little protrusion there. And in which case they might do traction or something like that. There's a lot of chiropractors that specialize in that versus the surgery right away. So there's a lot of things you can do. If they find something called stenosis, which the cord is smaller, vitamin K2 is really good, and then keep doing your intermittent fasting because that reduces inflammation. If they find, arthritis and things, well, do the K2, keep doing what you're doing. But if it becomes a big problem, you're just going to have to take the next step. But I always like to start things really conservative and then work up to it. Do a lot of stretching, that's going to help, and then maybe a little bit of traction or that inversion table. Okay? Thank you so much for your call, and we're going to go right to Gina. She's been waiting for a bit. You're from New York. Go ahead, Gina.
Yes. Hi, Dr.
Hi.
Berg. Thank you. And hi, Karen. Thank you so much for taking my call. I know you have a lot of calls, so I'm going to try to be as quick and concise. Quick history for me. I'm 51. I'm about 5'5", and right now I'm 151 pounds. I'm predominantly thyroid body type, and I've always been pretty active my entire life. loved working out and doing sports, and I feel like I always ate healthy until I found out about keto and realized that, oh, quinoa is really high carb. So I, always ate vegetables and salads, always had pretty regular bowel movements, and I had started taking apple cider vinegar before doing keto, and I've always found that when I took it, it would just start stimulating my bowels, and I'd have a pretty good movement in the morning and be gone for the day. In December, because as I got closer to 50, I just noticed that my weight was just going up and up. I had really bad cravings for carbs. I would just come and binge on popcorn or whatever I could find, and but still try to eat healthy, but have those moments of weaknesses. And so in December, I started learning more about keto, and I started with low carb, high fat. And that, of course, found as soon as I started eating that way, my hot flashes went away, the cravings went away, but I found myself being more constipated. And then in January, really found more of your videos and started following what you were saying, and started with IF in January, about 18.6. And then I moved to a 4-hour eating window, and the weight started coming off, but very slowly. But I was just really happy about not having any more cravings and being able to control more of what I was eating. And, my clothes were fitting better, but I couldn't, my clothes were fitting better, but the weight wasn't coming off that fast.
Okay.
Then in April, I did the 72-hour fast with the group online, and I lost 1 pound. But in February, I got down to 151. So I was like, okay, I'm just trying to break to that 140, get into the 140s. Lost a pound after the fast. And then now, for about a week, I've been doing 1 meal a day. Go ahead, sorry.
Okay, so there's, I want to do a really quick evaluation on you because there's a lot of other callers. But so you're in the thumbnail sketch, you need to speed up your weight loss, right?
Yeah, but I have one other thing I just don't want to drop out too.
Okay.
There's the weight loss thing, my hot flashes. So I started taking the kelp in February, and it felt like the hot flashes came back, and so I stopped it, and they seem to be gone now. So I don't know if you've ever had that experience with the kelp affecting hot flashes that way. I just stopped it to see if they would go away, and they seem to be, but I don't know if that's normal or what, or if it's because of the kelp. And also, I wanted to know about your keto coach course, because I've been trying to find out more information, but I couldn't get anything. So that's basically it.
Okay, great. So
Sorry.
Let me quickly go right into this. Number one, usually kelp will help regulate estrogen, so that usually will help. If it doesn't, go with the cruciferous vegetables. Cruciferous, maybe Brussels sprouts. That will help you balance estrogen in a different way. Okay, so that's one thing. The slowness of your metabolism, I think you're doing the right thing. You're doing intermittent fasting. If it's taking a lot longer, it tells us, your metabolism probably going into this was pretty slow because you probably had some pretty bad insulin resistance. So it's going to take a little more time. Also, don't just look at the weight loss, look at all the factors. Energy, the fact that your cravings are going away is good. So that's all really good. But so what I like to do is plug in intermittent fasting, make sure your carbs are low. You might need to bring them down below 20. Make sure your protein is not too high. Like even 3 ounces I think would be fine. And then of course then the fats, because we want to force your body to burn more fat. Yes, we want to do low carb, but if you're having problems and maybe your thyroid's involved, you might not want to go crazy with the fat. Just do enough to keep you fine so your body starts to burn your own fat. It's a little, watch my videos on the extra fat because you can overdo it with the fat. I look at the stress, the sleep, any other health problems, and then plug in the exercise. Those are all the things that you can do. And then the Keto Coach, we just now released a new course for those people that want to become certified in becoming keto coaches. It's a training. It's awesome. It's even though all the training and the lessons are broken down into many little courses, there's actual exercise that you're going to do. And the data is, I have a little data on the website. But basically, it's only 5 and almost 6 hours of material, but it's broken up in little chunks. So you can get through it rapidly, but you have to actually apply everything that you're learning so then you can get certified. And if you like helping people, definitely you want to be a keto and intermittent fasting coach. So I show you how to do it healthily. And then that way you can actually start to have fun just helping people. So it's really, a lot of existing health coaches are learning this because they just want to help people more. So the whole goal is to increase your ability to help, and it's very fulfilling. So, so you can go on the website to get more information. But thanks, Gina. I hope that helped you. All right, let's go to Karen. What do we have on social media?
Hi, well, first of all, I wanted to say welcome to the Facebook viewers from, we have Puerto Rico, Wyoming, Arkansas, Baghdad, Denmark, Switzerland, Australia, the Netherlands, and more and more and more. So welcome, thanks for coming. And I'm going to go right to Maria on YouTube, who's asking what can she do diet-wise for receding gums?
Well, receding gums is it's usually a vitamin C deficiency, but you don't want to just take regular vitamin C because a lot of times it's synthetic. It's made from cornstarch and sulfuric acid. Synthetically, you make ascorbic acid. So you need a real good food-based, you can do camu, alma berry, or even just start consuming a lot of bell peppers. So that's one thing. And as you improve your insulin by doing intermittent fasting and keto, your absorption of vitamin C will go up because high levels of insulin will suppress vitamin C. And if you're a smoker, that'll do it as well. So it's vitamin C, that's what she needs.
Okay, good.
Yeah.
Do I get another one?
You get another one.
All right, great. So we have a question on Facebook from, I think it's Ricky, who's asking about the body types. Now, body types and keto, working these two together, what if you're a thyroid, but you're something else as well, and you have other issues that don't seem to fit? How do you work the body types in with keto?
Well, the body types are kind of like the icing on the cake.
Okay.
Or maybe I shouldn't talk about that, but the whole goal in this book is to get in the basics, like 2 weeks, get in keto intermittent fasting, really groove that in, get some results, and then we can tweak it with different layers. As you can listen on all these calls, not everyone just goes right into this perfect scenario where they're getting results. A lot of people have adrenal stress, liver problems, thyroid, ovary, the menstrual cycle, hot flashes. So that's where the body types comes in there, because what we want to do is we want to strengthen, if let's say you have a thyroid issue and we want to strengthen that, but you're a little combo adrenal. I explain what to do in the book, but if you're confused, just do one thing and then maybe take some C-Kelp. And then if you're not happy, add some support with the adrenal, because it's really hard to know in advance, Karen, if you're like one body type and not a combo, and what's the primary, because unless you do some test, I mean, what are you going to do? Like measure the hormones? A lot of these things are subclinical. The endocrine system is on a series or a chain of glands, and when one goes down, they all tend to go down. So it's almost like you got to look at it from one organ. And if you support the thyroid, guess what? You're going to also improve the other glands. How was that for an answer?
That was really good. So should someone start with the body types, or should someone start with keto IF?
Start with the keto IF first.
Okay.
Then after 2 weeks, we're going to tweak it. Okay, keto IF is the meat and potatoes, and the body types are the icing on the cake.
The meat and the vegetable.
Yeah, maybe I should. That's kind of bad of an analogy.
Bad analogy.
Yeah.
Okay.
Okay, so let's go to Chris. Chris has been waiting for a bit. You're from Rhode Island. Go ahead, Chris.
Yes. Hi.
Hi.
Can you hear me? Hi, Karen.
Hi.
I think you're so fun.
Good.
Yeah. I have insomnia. I have had it for 40 years. Okay. I've been to 6 sleep studies. I had to quit college. It ruined my life. I wrote down a few things that I think might be going on. I found out about the GMOs and the glyphosate and the Roundup, okay, and I was doing some research. And looking back, I changed my diet 40 years ago. I switched from white bread to wheat bread, and I added milk, orange juice, thinking I was getting healthy. Who the hell knew I was eating all the freaking glyphosate, and being poisoned? So my system is sensitive, and I think that's what happened. And so there I was, doctor after doctor, millions of doctors looking for a cure for this insomnia. So I was doing research with the GMO because of you, and I find a Dr. Stephanie Seenoff, who's an MIT scientist. And so she's saying how the glyphosate can kill your intestinal bacteria, and that stops tryptophan from getting made, and serotonin and melatonin. And I said, that's it. That's gotta be it, you know. So and then I find out 4 years ago I had a parathyroid tumor, and I flew up to Florida and they took it out. And the doctor Norman up there said, "You're going to get your life back now. You'll start sleeping as soon as we get this tumor out." And still no sleep. And
Okay.
here's the problem: I'm so desperate. I don't have a life because of it, and I have trouble taking supplements because they make me feel weirder.
Got it. I have a question for you. Are you
Yeah.
doing keto and intermittent fasting yet?
Yes, I started it a couple of months ago. Yes. And
Okay.
I lost 14 pounds, I'll just tell you.
That's not bad.
Wow. Something's
Great.
happening.
Yeah,
So okay.
I love it. I love it.
So
yeah.
I have one question, Chris. This has been going on for 40 years, right?
Yeah.
And 40 nights. 40
40
40
years
years.
of nights.
40.
40 years of nights.
Yeah.
Tell me, there had to have been a point where you were sleeping at one point in your life, right? Because you're 41 years
Oh,
old.
yeah. I used to sleep like a baby.
Right.
I mean, I used to love sleeping. And then it turned on like a switch. I
Yeah.
seemed to grab the back of my, bottom of my brain, neck, at the base of my skull. And it seemed like something stopped flowing. And I end up in the emergency room saying, you know, something stopped flowing.
Okay,
My
so-
brain feels like it's turning purple. And, you know, they think I'm nuts and they take an MRI and they
So,
find
but-
nothing.
Right at the point
Mm.
when you stopped sleeping, there must have been something that occurred right before that. What happened just before you stopped sleeping?
Well, I changed my diet, like I said. I switched to wheat breads and everything.
Okay. Okay.
Yeah.
Okay, so there's a couple things that you should do, Chris. Number one, I think do what you're doing, keto and intermittent fasting. But there's an acupressure technique. I actually even I teach people. It's actually it's in a webinar called the Stress Webinar. You can look it up. There's a little device. I don't have it in front of me, but it's a massage tool. You need to get that. And no, that's fine. I'll just explain it. This tool, you can do the neck points, you can do the stress points, and it basically extracts old stress. I use it every night before I go to sleep, and this is what it looks like. Put it in the back of the neck. You kind of stimulate different points of the neck, which relax the body, and I think that'll really help you because there's certain nerves and things that are connected to the back of the neck that actually affect sleep. Like the sleep centers are located back there in the brainstem. So if you did that, I think that would actually kind of turn off the switch and help you relax and help you sleep because really the body is kind of stuck in a stress mode. If you go to sleep and there's certain parts of your body that just won't turn off, like they're just like on all the time, that's what this does is it turns it off. That's what I would recommend. And then of course, whatever triggered it, obviously you start eating the wrong foods. So I think that's your best bet. And of course, there's a sleep aid which supports the adrenal, but I would go with this one first. All right? Thanks, Chris. Thanks for calling. All right. So, hey, guys, for those of you that want to listen to this and are driving, you can go to TuneIn. It's an app. Or like on your cell phone, you can download the app. It's called TuneIn. We're on TuneIn. We're also on Anchor. You can check it out. And also, if some people ask about body types, there's a link down below. Take the body type quiz to see what your body type is. Of course, not right now, but when we're done, okay? Because we want your focus, your attention. And yeah, so hey, Karen, what kind of questions are we getting on the social media platforms here?
Okay, good. So, and hello to Ethiopia and Sweden and San Diego and Uganda. Wow, that's awesome. So Lisa's has attention on the fact that she can't eat enough calories. So she's trying to figure out what to change. Can you address calories in keto?
So I'm guessing,
IF.
Lisa, that you're not trying to lose weight. That's what I'm guessing.
Yeah, she
And-
doesn't say.
Right, so if that's the case, you're trying to get more calories, well, guess what you're going to have to eat more of? The calories that are double the calories per unit of weight. So that would be the fat calories. So that's how you do it. yeah, especially with people with a fast metabolism. Let's say you're 18 years old and you're like thin and you want to do this, boy, you're going to have to definitely beef up the fat, so to speak. And don't forget the vegetables as well, because if you need all that green. It's not just about fat and low carb. It's about healthy, put some things in there. And I think that's really what's missing with some of the bad PR on keto. They're operating off the older studies for epilepsy with kids using just like oil and fat. And we're talking about a healthy version, which is a lot more greens and vegetables. So those are all the phytonutrients that you can get. I mean, the vitamins and minerals. So just that's just a mental note on that, Karen.
Okay.
Okay?
Mental note.
Mental note. Noted.
Noted.
Okay. Hey, Lucy, you're from Atlanta. You had a question. Go ahead.
Hello, everyone.
Hi.
I have two quick questions. My first question is, does apple cider vinegar take you out of intermittent fasting?
Good.
And
Good question.
the second question is, I was recently diagnosed with vitiligo.
Yeah.
And I was doing some research on it, and I saw some people were saying that if you ate certain food or don't eat certain things, that might either slow it down or even reverse it. I'm in the beginning stages, so I was wondering, would the ketogenic diets and intermittent fasting and or block fasting help?
Good question, Lucy. Let me just answer the first question. Yeah, drinking apple cider vinegar will not break your fast. Make sure you dilute it in water. Some people, they take it straight down. You use a straw because it's very acidic. It can mess with your teeth. So no, it's not going to break your fast at all. In fact, it'll improve insulin resistance, your blood sugars, and help you go longer with intermittent fasting. And it's great for balancing your pH and supporting the liver. Okay, so that's one thing. Now, vitiligo is a loss of pigment. So you have these little lighter colored specks on the body. And that usually comes from an adrenal issue where your adrenal hormones, you don't have enough. It's kind of a burnt out adrenal. It's like a low cortisol situation. There's even a condition called Addison's, which is an overwhelming adrenal situation where you lose your pigment. So yes, ketogenic diet, intermittent fasting is great for this. I'm not saying it's going to be the answer, but it's going to definitely help you tremendously. The thing that I would research and put your attention now is adrenal function, improving adrenal function. And I have a lot of videos on that. So I would just search out those videos to get more data on that. Okay? But thanks for your call. All right, Derek, you're back online. So it's been a whole week. How you doing?
Derek, we missed
good
you,
morning,
man.
Dr. Berg.
What took you
Good
so
morning.
long? I mean, we've been on
Good
now
morning,
for
Karen. How you
15
doing?
minutes.
How you guys doing?
Good.
Awesome. Dr. Berg, I'm still having an issue with the acid reflux. It's been better, but it just seems that this valve doesn't close. I'm taking a few of your supplements. I'm taking the insulin and blood sugar formula.
Mm-hmm.
I'm taking the adrenal and cortisol support, and I'm taking the gallbladder formula, and I also take the benfotiamine, 600 milligrams a day.
Okay.
I feel like there's something like in my chest, or sometimes it feels like maybe my stomach is hooking on the left side, my left ribs. Yeah, I'm not sure.
So I have a
Feels
question.
like something is in my, yeah.
I can't remember if you told me this or not. Do you have a hiatal hernia?
That's the thing, right? I went and I got a GI X-ray. This was back in end of October, and they said possible minimal hiatal hernia. But then 2 months later, I went and I took a endoscopy, and then there was no hiatal hernia appreciated or present.
So this is the next tip. Okay, we're gonna give you one more tip here. Okay, this week, until next week. No. But here's what you do, Derek. I think whether you have one or don't have one, because you can apply this to either situation. Yeah, we're trying to handle it with different chemistry, different nutrition and foods. We're getting some improvement, but we're not fully handling it. So my whole thought is, why not physically do something about it? Like I would use the tool, I think you have it, or your thumb and go in there. And I just released a video this morning on hiatal hernias, what to do, but it's a manipulation. It's a kind of a, you go to the massage therapist, you work on your muscles, but guess what? The diaphragm, last time I looked, Karen, was a muscle, right?
Yes.
The diaphragm?
Yes.
So
Thank you for consulting me on that.
yeah, I'm just double checking that.
Okay. Right.
So you can go in there and start pressing up underneath your diaphragm, your rib cage on the right side. Just don't press on the center, go to the right and to the left and start massaging up there. You're probably going to find there's a lot of tension and congestion and knots. So you're going to kind of press up into there. You're going to be pressing on the stomach area, and you can help increase the tone of those muscles to help relax it and let things drain. I've done this on different things where like the ileocecal valve down here and the different parts of the colon, and you can actually manipulate that. I would physically work on that. And if you use the longer prong here and press it in there over a period of time, you should get some nice depth and massage in there to help the tone around the stomach, around that little valve. I think that will help you. Thanks for calling, Derek. All right, Karen.
Okay.
Let's go to the social media here.
Yeah,
what do we
good.
have?
So we have Lori from Germany who is asking if it's okay to do intermittent fasting every other day.
Oh,
I
wow.
also had another question, not sure which media it was, but can you do intermittent fasting with any diet, keto
Okay.
or otherwise? So why don't
Yeah,
you take
you,
those two.
you can do it every other day. That's not a problem. I think you should try that as your way of doing this. And then over time, try to do it every day. Now, should you do it with any other diet? Yeah, you can do that. You're just not going to be as successful. The reason why is when you do intermittent fasting with any diet, then you're including the diets that have more carbohydrate. And that's where the challenge is, because then we still have a little bit more insulin spike.
Right.
And then what happens, it makes it harder to transition into keto. However, as a tool, Karen,
Yeah.
Intermittent fasting is a very powerful thing to add into any diet. It's definitely going to be better than not doing that, but the optimum solution is to combine things that lower insulin from the diet and intermittent fasting. All right?
Good.
Okay,
I
good.
like it.
Okay, good.
Okay.
So now we're going to go right to, I think it's Zeke from Georgia. Go ahead. You had a question.
Hi, Dr. Berg.
Hi.
Thanks for taking my call.
Sure.
And I'm 8 years old, just so you know.
Oh, cool.
And I had a question. Yes, I'm 8 years old. I had a question about leg cramps and electrolyte.
Okay.
So I get leg cramps sometimes in the night, and you say your electrolyte shake can help, so I drink your electrolyte shake.
Mhm.
Yes, powder. And so what are some things I can eat throughout the day to help me not get those leg cramps?
That's a good question. As far as your eating goes, do you ever eat those things called vegetables?
Yes, I eat them every night.
Okay, good.
I'm happy when I get broccoli.
Okay, good.
Broccoli, good.
Good. Do you do any type of cheese?
Oh, I love cheese. I get cheese sticks, square cheese, round cheese,
Wow.
pretty much every kind of cheese.
That's incredible. You're doing great. Yeah. So
Wisconsin.
then, what's that? Oh, Wisconsin.
There's a
You're
lot
from-
of cheese from, yeah.
Oh,
cheese
hey,
comes from Wisconsin.
you're talking to a cheesehead right here. So
Dr. Burke's from Wisconsin.
yes,
Yeah.
What town are you from?
Yeah.
they're from Georgia.
Oh, George.
Georgia, Wisconsin.
I thought you said you were from Wisconsin.
So usually
Never
the
mind.
leg cramps, okay, they're usually mineral deficiencies like low potassium, which you normally get from the leafy greens, avocado, okay? And then so that's how you'd get it, right? You also magnesium and then calcium from cheese. But let's say, for example, you still have leg cramps, right? It could also be a vitamin B1 deficiency. Have you ever heard of something called nutritional yeast?
My mom's told me about it, but I've never eaten it.
Okay, that would be the next step. I would get some vitamin B1 from nutritional yeast, and that usually will help you And also if it's tender, if you press in your calves and it's tender, that could be it. The other thing that you should look up on my videos is a stretch for something called shin splints. Okay, just try to remember that. I'm sure your mom's listening. Shin splints. Watch that video. There's a stretch that you can do to help cramping in the calves. Okay? But that's a really good question, Zeke. I really appreciate you calling in, and it sounds like you're a pretty sharp kid, so well done on that.
Yeah.
Okay?
Thank you.
Thanks.
You're welcome.
Okay, see ya. Wow, this kid
Oh,
was
wouldn't
sharp.
it be awesome if your callers, if that was a trend, like your callers were 8 and 10 and 12, and they just
I would
knew
love
what
that.
you
I
were
would love
talking
that.
about, and that's a goal, right? You
Yeah,
have to
like
write
have-
that book, that kid's book.
Yeah, that's great.
I know.
So guys, take my body type quiz, not right now, but when we're done. There's a link right down below, and then find out your body type.
Not
Okay?
right now. Right now, you just need to pay attention.
Yeah, that's right. Okay, so let me go, let me first ask a question, question number 1, because it's time. All right, Karen?
Yeah.
So make sure you make note of this on the
making
answers.
note.
This is question number 1. You ready, guys? What is the earliest biomarker for prediabetes?
Biomarker.
I knew you were going to say that.
Uh-huh.
Indication of, sign, or some type of
Like
thing.
a lab test or a...
Yeah, like something on your, some indicator in your body that will tell us that you have prediabetes. But what I want to know is the first thing that will show up as a body marker
So
for
it's not,
prediabetes.
not necessarily a lab test, but something that you might observe in your own body.
No, it's actually a lab test.
Oh, it is.
Yeah. Okay. What would be the first indicator, guys, to know you're a pre-diabetic? Let's see if we can get any correct answers.
Okay.
Okay. So while they're answering that, I want to go to Gina because she's been waiting for a bit, and she's from Chicago, which is very close to Kenosha, Wisconsin. Go ahead, Gina. You had a question.
Hi, Dr. Berg.
Hi.
First, I wanted to just say that I was at a retreat in Wisconsin recently, and I know you're always talking about how dietitians don't recommend intermittent fasting, but the one that I had an evaluation with did. So
Wow.
that's how I kind of discovered your videos. But anyway, back in 2003, I had a complete thyroidectomy for thyroid cancer, and so I'm on Synthroid replacement therapy, for the rest of my life. And I have a whole host of problems. I could take up the entire show asking you questions. But anyway, I kind of wanted to know if there are any adjustments that I need to make. I've started on the keto diet and the intermittent fasting. I'm mostly doing 16-8, but trying to do a couple of 24, eating once a day. But are there any adjustments that I should make? Because it seems like you talk a lot about thyroid in your videos, and I don't have one, so I'm not sure what to do.
Right, exactly. And then sometimes people think, well, if I don't have one, I don't have the problem. But what I'd like to do is kind of look at the real issue that you got in the first place, which is not really thyroid, it was the immune system. That's the area that I would put more attention on. So let me just kind of give you some tips on that. The immune system. One of the best things for the immune system is something called glutathione, but you can get that from food, cruciferous. Now, when I say that, what's going to come up is, I thought that cruciferous was bad for the thyroid because it depletes iodine. Well, I think you had an immune problem, not a primary thyroid, but because you don't have a thyroid, you're taking Synthroid right now, which is fine, because if you have to take that, I would maybe add a little bit of sea kelp and consume cruciferous on a regular basis, simply because the power of glutathione to improve the immune system in addition to protecting yourself against future cancers. So that's one thing. The other thing is you want to make sure that you do not consume any food that's GMO, so you're going to have to go completely organic, because that's the glyphosate, creates issues with the soy and all that. So those are some things that I would do. Intermittent fasting and keto, definitely, because you're going to drop insulin. I mean, right there, you're going to decrease your risk for a lot of different types of cancer. And again, I always like to look at it, what can you do as if you, still had the problem? What can you do to maybe prevent it from the entire body, because I think just the fact that you had cancer, just as an indicator that we just need to keep strengthening your immune system as much as possible, bringing sugar down, increasing cruciferous. But make sure you take some iodine from the sea kelp. Thanks, Gina. All right. So, what kind of questions do we have coming in from social media now, Karen?
Okay, so do you want a question?
Oh, I want the answer to the question. Yes.
Right. Right. Well, some people are putting in body symptoms, but you said lab tests.
Yes,
so
lab
I'm only
tests.
going to give you the answers from that apply to that. So we have some people saying A1C, and you might want to explain what A1C is.
Mm-hmm.
Some people are saying blood sugar,
Mm-hmm.
and fewer people are saying cholesterol-related LGL kind of answers.
You know, this is probably going to be, if you're really into it, kind of shocking news, but it's something that is totally an amazing discovery of a doctor I did a video about, who wrote a book about this, and he tested 14,000 people, and this is what he found. This guy's super credible, MD, and I need a drum roll, please. The answer is insulin. Insulin.
Insulin.
Yeah, high levels of insulin.
Someone did say that. I think one person said that.
Okay, well, they were correct. So what happens, the earliest indicator of prediabetes is not blood sugars. Blood sugars are late on the chain of events. Blood sugars change when your body adapts because it's adapting to insulin resistance. It's like it's failing to adapt to insulin resistance, basically. So you have, first thing is high insulin, and guess what they never check, Karen?
Insulin levels.
They never check insulin. And I'm not just talking fasting insulin, I'm talking about a post-meal. It's called post-prandial insulin test. And basically you check it after you eat, and what you're going to find on a lot of people is they're going to have a high level of insulin with normal blood sugars, and they're total pre-diabetic. Karen, you can have pre-diabetes. I'm sorry, you can have diabetes and have normal blood sugars. Did you know that?
No.
And this is kind of new information, but it's totally true. So insulin, high insulin, is the first indicator, and that's why I keep bringing up insulin. If you could just lower your insulin, you'll actually be very, very happy. And just what you want to do is, what triggers insulin? A lot of carbohydrates, and what causes insulin resistance is high insulin. Over a period of time, your body becomes resistant against it. So it's really the carbs, soy oil, and different vegetable oils will do it, junk foods, MSG, chemicals, trans fats will do it. So anyway, that is the first biomarker. And A1C is just a test it measures like an average of 3 months of your blood sugars, which is a good indicator, one indicator, but it's not the best. The best indicator would be insulin levels. But of course, you know, if I were you guys, the next checkup for your doctor, I would ask for a postprandial insulin test, and just to, if you really want to know, you know, find out from that. Okay? All right, so now let's go. Do you have any questions?
Okay, so I was reading a few things. You might have answered this in what you just said, but someone wants to know, on YouTube we have, well, people don't use their names on YouTube mostly, so someone's asking, how do you test for that? If you're at home, how do you test for these insulin levels?
There is a spot test. It's called the insulin, I think it's an assay spot test. It's a home test. You can do that. But you could also just go and request it from your doctor. Find a doctor that will do it, and then they'll test for the insulin.
And then what are the little tests the little things that you can prick your finger at home?
That would just be a blood sugar test. Yeah, which is basically late on the chain of events. By the time that shows up, you already have a big problem.
Oh.
So wouldn't it make sense, Karen, to check the earliest signs of something? Would that be the best thing?
That would be the best thing. Now, I have another question. Because if you have diabetes, you're at the end of insulin resistance, right?
Well, you have insulin resistance. It depends how you're adapting or not adapting, because insulin resistance is always going to be in a situation with diabetes type 2. So what happens, we're starting to have, you could actually have insulin resistance and have normal blood sugars. And then when you start failing to adapt to this situation and the body is becoming overwhelmed, now insulin can no longer control, the insulin goes higher, it can no longer control blood sugars, so the blood sugars go higher and higher and higher. But what happened with some people is because the higher insulin, it pushes the blood sugars down and you start having hypoglycemic symptoms. So low blood sugar is not just not eating sugar, it's high insulin. That's pushing the blood sugars down, giving you hypoglycemic.
And they tell you to eat a piece of candy.
Right. And some people say, well, I was tested. I have all the hypoglycemic symptoms, but I was tested. Everything comes out normal. Well, it could be those symptoms are either subclinical or you have insulin resistance, which is basically your cells are so depleted of glucose, and the symptoms are very similar to low blood sugar, but it's maybe not in the blood sugar, it's in the cells, so it's not showing up in the cells. So again, to understand this, you have to kind of get the whole picture and understand some basics, but yeah.
Okay, good. And then when you have diabetes, it's from too much insulin.
Yeah.
But then they give you insulin.
Right, because too much insulin actually causes your cells not to absorb insulin. It's called insulin resistance. So you have a situation where you have the insulin's not working anymore, but you have too much insulin, which is deadly. Too much insulin is just as bad as high sugar. I mean, that's why just think about the insulin shock therapy where they inject people with all this insulin and they wake up fat and they have all these other complications. So if anyone is skeptical of that, just look up all the symptoms of hyperinsulinemia, okay, and you will see they are even worse than high sugar, high blood glucose. Okay? Is that sufficient?
That's great.
Okay, good. All right, so
take a call.
Let's take a call. Ashley, you're from Memphis. Go ahead. You're on the line.
Hey, Dr. Bird, Karen,
Hi.
how are you?
Good.
Good.
Thank you very much for taking my call. I'm calling on behalf of my mom. She is 78 years old. She has two major issues. One is urination. The second one is insomnia. Urination is because she's thinking about taking cranberry powder capsule because her urination is very weak and usually come out in two parts. And the first part is weak, and the second part is even weaker, and the second part take longer to come out. And she is thinking about taking the cranberry, see if that works. And the second part, the second question about the insomnia is that's her major issue, and she has been taking your sleeping aids and also the acupressure tool, and she used the acupressure tool the first day. It worked, but after that, she wake up at like 3 o'clock in the morning and using the acupressure tool, and it doesn't work anymore after the first day. And what else that she can do? I appreciate that you give me some advice.
Okay.
Thank you.
So someone like that, here's what you want to do, especially with your mom. You definitely need to do keto and intermittent fasting, because it sounds like that high urination, high levels of excessive urination, which is basically kind of a pre-diabetic or a diabetic symptom. So that's the area that she needs to go into, like more strict on the keto and more intermittent fasting to improve the urination. And that will actually help the sleep as well. As far as the cranberry, it's probably not the best remedy for the flow of urine. What might be better, especially if she has insomnia, is to have celery in the evening, like a little bit more celery, maybe as the last meal, have 4 stalks, and then maybe some asparagus, which actually would be good as well for urination. Okay? Thanks, Ashley. All right, Sonia, you're from Florida. Go ahead. You had a question.
Hi, Dr. Bird.
Hi.
Hi, Karen.
Hi.
I just want to first thank you so much for all of the education that you put out there for those of us that have been confused for all our lives. I'm 53. I just want to give you a quick rundown. I'm new to keto. I actually started IF in February, and I was doing a 20-hour fast and a 4-hour eating window, but I was just doing the IF. I didn't know anything about keto, and so I was just eating whatever I wanted during the 4 hours. And I actually felt quite good. I was sleeping better. I already started to, I just felt really good. And then my husband stumbled across a couple of your videos, and we've been pretty addicted to learning as much as we can, because we realize that our entire lives we have been fueling our bodies with carbs, sugars. I don't like vegetables. Everything I eat is pasta, bread, potatoes, sugar. And I am 53 years old. I have been overweight pretty much my entire adult life. And you know, what doctors will call obese, because I'm 5'3" and I weigh, the last time I weighed myself, I was like 265 pounds. But I want to say that I have never had, I'm on no medications. I've never had issues. I did suffer with with kidney stones when I was like 30 years old, and then again when I was 40. And then all of a sudden when I was 45, my gallbladder ruptured and I had to have my gallbladder removed.
Wow.
So my question is, I started, when I started your videos and I started finding out about bile and how important that was, I went right away and I got your fatty liver formula and your gallbladder formula, because I'm, you know, a bit panicked about, well, I have no gallbladder. Where's the bile? How am I going to start to digest some of these fats on the new keto that I'm on? But I also, because I don't like vegetables, I'm taking your wheatgrass. I went right away and started taking your wheatgrass. I'm now about to start your kale shakes and your electrolytes and your cruciferous. But because I've never taken supplements or medications my whole life, I feel a little bit overwhelmed. Like, am I supposed to be taking all these things every day at the same time, or can I kind of spread them out?
Yeah, good question. Yeah, just spread them out, make them more comfortable for you. But the best time to take them is probably the first meal, at least the electrolyte powder and the wheatgrass juice powder. So, and then you take one gallbladder after you eat. And then you can just spread the other ones out. They're not going to increase insulin. But here's the thing. Somehow we got to figure out how to get some vegetables in your body, one way or the other. So either have maybe someone maybe chew them for you if you don't like chew them. No, don't. Or maybe steam them or have a fermented vegetables. But you definitely need to find some vegetable that you can get in your body. This is very, very, very important. So that's what you're going to have to work on. But definitely keep going to IF, and because you're gonna start losing some serious weight. And as all this fat comes out of the body, if you don't have enough of the vegetable, could be a little bit of a situation, because we want the vegetables to keep the liver nice and clean. But yeah, and especially if you don't have a gallbladder too, because you need that bile to help you detoxify that. So, all right, so bite the bullet, Sonia, and just do what you can. All right. Karen, I have another question we're going to throw out there.
Okay.
Okay, guys? So here's question number 2. What is the worst sugar? A, table sugar. B, agave nectar. And C, just pure glucose. What is the worst sugar of those 3?
That's a really good question.
See if you guys could come up with an answer on that. And as you're answering, let's go to social media. Let's take another question.
Good. Well, first, I want to say hi to Seth, because he mentioned that YouTube users do use their name, and it is true. They do use their name.
Oh, wow, I didn't know that.
Sometimes they have like account code names, you know?
Yeah.
And the whole screen I'm looking at doesn't have a name, but Seth's right. Okay, good. So what about rosacea? Keto, IF, and then I think it's Ziu is asking, what about grape seed fruit? I think she means grapefruit seed oil. What would you recommend?
Well, I know some people are going to say, wow, every single condition is caused by insulin resistance. Isn't there another cause? But I'm sorry, there's probably the most likely cause is insulin resistance, because you see with diabetics they have the rosacea, but it could also be caused by a mold in the body, in which case you would take grapefruit seed extract. That will help you. The other thing that it could be is an adrenal body type issue, because the adrenal increases cortisol, and that usually shows up too in the cheeks. But here's the thing with all these conditions, Karen, that people have, and I know it's like, okay, what do you do for this? What do you do for that? Just start with putting in the basics, keto intermittent fasting, and just see if anything is left after that. It should take care of a lot of problems, because if you don't have these basics in, you're just like chasing this little symptom around in a circle, round in a circle. And I remember when I was really sick, like when I was 28, 2 years ago, Karen would drive me around. We were in San Diego, and we would look over there. Oh, maybe I should go. It's called the Health House. I can go in there. We go in there, take all these vitamins, and oh, here's another health food store. And I would take all these vitamins. I had a couple vitamins in the cupboard, didn't I?
A few.
But I had a lot of issues. Didn't I? You don't have to agree with me, but
He was sick as a dog.
so I had a lot of problems. And what I was trying to maybe trying this remedy, but what was I eating?
Right. You were chasing every individual symptom. What pill should I take for this? What pill? And you weren't taking drugs, but
No.
you were looking for things to treat each symptom.
I mean, I was doing Ben & Jerry's every night for sleep.
What about
because it helped me go to sleep.
Yeah. We won't talk about the drive-through margaritas.
Okay, so that was a little phase, but that didn't help. Or the massive carrot juice. I had like so much carrot juice.
Carrot juice, pasta.
And this huge loaf of bread. I'm like, what am I doing? So I had a lack of awareness, probably the worst. Of course, that's why I'm doing this right now, because I overcompensated. Okay, so we're going to go to Kathy. Kathy, you're from Florida, Tampa. You had a question. Go ahead.
Good morning, Dr. Berg and Karen. Thank you for taking my call and all of your work in the field. It's life-changing.
Good morning.
I was a patient of yours, and I've been following you for 14 years. I'm in Tampa now.
Oh.
And I'm calling because I'm desperate for your help again.
Okay.
I've been doing the intermittent fasting since last summer. I added keto in October, and I've been gaining weight. But I just want to go over some key points in my history. In 2005, I had the lap band surgery. Last year, March, I had emergency gallbladder removal. And then in the summer, like I said, I started fasting daily. This past October, we decided to empty my band because I had some GERD, and so that I could eat more vegetables because I love them. I just wasn't able to eat a lot. I'm taking all of your recommended supplements I have for a long time, especially apple cider vinegar, betaine hydrochloride before the meal, the gallbladder, and extra bile salts after my meal. But since I had the band removed, I've had a lot of bloating. And another note, this past 3 weeks, I've done the standard process 21-day cleanse out of desperation. Today's my last day. And at this point, I'm at a loss. I'm frustrated. I'm 48 years old. I'm also dealing with menopausal stuff. And it's getting depressing not seeing any results because everyone else is getting them.
Yeah.
You know, and I just need your help.
Yeah. Here's a couple things you could do, Kathy, because you're dealing with just the machine that's supposed to break down food is not exactly what it should be. So we're dealing with kind of an alteration of your digestive mechanism. And then they took it out, and now you're bloating. So the 21-day cleanse, I know it's a lot of vegetables. I don't think you can break those down yet because it takes a lot of flora and a lot of chemistry down there. So I think what I would do if I were you is I would do a smaller amount of vegetables and steam them, and maybe a little bit of fermented vegetables to slowly ease into this. I think you definitely need to focus on intermittent fasting, hardcore, 1 meal a day, for sure. You're going to have to substitute. You're probably already doing that. And start to focus more on the flora, the microbes. Maybe get some, it's called effective microbes that you could start taking. That will actually take the stress off the stomach because you'll start to digest more in your small intestine. Then the last thing I would do, because you have the stomach thing, and you can either take the device or your hand and start massaging underneath your gallbladder, the rib cage on both sides, and start working physically those digestive organs to stimulate them to work better. So the combination of manually working on the muscles around the organs and then cut down the vegetables, because I know that's probably bloating you, and then slowly work up to this with intermittent fasting. That's what I would do. So try that and then let us know how you do within a couple of weeks, okay? All right, Karen, what answer do we have on number 2?
Okay, well, these guys are saying all of them are bad. Yes, all of them are bad.
It's all relative.
But you did say which was worse.
What's worse?
What is worse?
Yeah.
And we had a couple glucose, but we've had a couple agave.
Wow.
Mm-hmm.
Really?
Yeah.
Do we have a drum roll, please? And the answer is agave.
Agave.
Now, why, Karen, is that bad?
Because it produces a fatty liver.
Yeah, but why?
Because it can't be processed.
98% of it's fructose.
Well, that was the given.
Oh, okay, all right. So you already knew that. You just didn't want to.
I didn't know you were asking that.
Yeah, that makes sense.
Everybody
Okay.
knows that.
Yeah, it's true. So agave has a lot of. See, table sugar is 50% glucose and 50% fructose. Fructose is handled differently in the body. The liver, you're just going to put someone right into a fatty liver, insulin resistance. And then pure glucose that's better than table sugar. Yeah, I know. So we want to stay away from the fructose, okay? Now, people are going to say, well, what about fruit, right? Well, I'm not recommending on the keto, but it's definitely better than high fructose corn syrup because you have all the fiber that buffers it. But the problem in the last, I don't know how many years, we did hybrids of our fruit to make fruit more sweeter, sweeter, sweeter. Like apples now are very sweet. I think even a watermelon is morphed into this very sweet watermelon type thing. And you have honeydew melons, right? All these fruits were not sweet long ago. And plus they're seasonal, not meant to consume 24/7. That's just my opinion, Karen. Okay.
Got it.
And guys, if you want to take the body type quiz after we're done, there's a link down below. Okay. And also we are on TuneIn on the radio, so you can check that out. There's an app on that. And we have a few more questions, so I'm going to go right to Mitzi, I think.
Up in there?
Yeah, Mitzi.
You go to that Walmart all the time when you're coming from Sunday, you see you go right around.
Hello, Mitzi, are you there? You're on the line. You're live.
No, that's way too far.
Okay.
Cypress, okay?
Cypress is way
All right, so we're going to put her on hold, and we're going to go right to Karen from Colorado.
Mitzi, you missed it.
Go ahead, Karen.
Yes, hello, Dr. Berg.
Hello.
My question is, I am 63 and naturally went to 2 meals a day before keto. So that was normal. Then my whole goal is to be healthy. Weight, I know, will come off if it's supposed to come off. So now I'm to 1 meal a day, and occasionally there'll be a 2 meal a day, but that hasn't happened for a couple weeks. But with 1 meal a day, I'm full before I finished my salad, before most of my meal is done. I'm just full. So then I think, okay, well, the window means I have 2 to 4 hours. So I'll go 2 hours and I'm still full. So really, I'm even now I'm satisfied. I eat at 1:30 about every day. Not hungry at the moment.
Wow.
So I don't know, should I be concerned? Will this over time fix itself, or what do I do?
So just you have to realize that what your body is doing right now, it's eating. It's eating 24/7 right now. It's just eating your own fat as fuel. That's the fuel that you're running on. So it's not that you're starving the body or whatever. So I think that's good. The fact that you're not hungry means that you're in fat burning. Okay. So then the question is making sure that you get all your nutrients, and that's really the key. So even if you're doing 1 meal a day, realize that you don't have to go crazy, like eat so many calories. You could actually do a meal, 1,000 calorie meal, or even a 1,200, which is not that big, with a little protein, a vegetable, and you don't even need to add any fat. Just make sure you emphasize the greens and the nutrients and the minerals and the vitamins and protein, so your body doesn't go after the protein, which it probably won't, but just in case, just do a little bit of protein. And if you're not hungry, ride the wave. There's going to be a point where your appetite may come back more, and let your body tell you what you need. As long as your energy is up and you're feeling good, you're fine. I'm going to be releasing more and more data on different meals at different amounts to make sure you get all your requirements. So just stay tuned. But thank you, Karen. Karen, we have another question we want to shoot out there to everyone, okay?
Yeah.
Why are nitrates used in meats? At the store, you buy bacon. Why do they put the nitrates in there?
Okay.
Okay.
Oh, I was going to answer.
I know
question.
you were. So I want everyone to
give
answer
you
that.
an
Why do
answer.
they use nitrates and like sodium nitrate? Okay, let's see if you know the answer to that one. Okay.
Okay, good.
All right, we're going to go to I think it's Tisa from California. Go ahead. You had a question.
Hi.
Hi.
Can you hear me?
Yeah.
Hello. Thank you so much. I love all your videos. I've been doing, since I found you about 5 weeks ago, I've been doing the keto. And I basically start the day with a bulletproof coffee, and then I actually put cocoa butter, but just hard, about 6 grams, and I do a teaspoon of the Brain Octane from Bulletproof, and then 2 teaspoons of the ghee, teaspoons, and that's what I do in the morning. And then around 12:30, I start with a juice that I've made from plants in my garden, collards, parsley, chard, borage.
Nice.
Put a tip of ginger, a lemon, and this lasts for a couple of days. And I use like I use like 8 ounces a day of this. It's got a tablespoon of vinegar each day, a tablespoon of cod liver oil, wheat germ oil, tablespoon, and half of avocado. And then I put 2 droppers of that trace mineral that you have, and a scoop of electrolyte and the wheatgrass, which I just found out I could actually have those separately, and it wouldn't change the fasting. So I'll probably do that. And I have like 1 or 2 of the nutritional yeast, the adrenal cortisone. I also take CoQ10 and magnesium because I had SVT that was really, really bad, but I was able to get rid of it with the CoQ10 and the magnesium and fish oil. And
what's your question?
Oh, sorry. I haven't lost any more than I lost the first week.
Okay.
Since then, I'm having 2 meals other than the juice. Sorry.
Okay. So this is what you should do. Okay. So you just started, and you maybe think you lost weight, but it stopped. Here's the thing. Don't just look at weight. Look at your size, your clothes, and how they fit. It's time to start doing, pushing that lunch to the dinner a little closer. But honestly, what I would do if I were you, and I talk about this, is nix the bulletproof coffee. Do 1 coffee without any fat, okay? And then call me back next week and tell me if you're finally losing, because I think you're just doing a little too much fat. That's what I would do. Everything else sounds pretty good. And next week, we're going to be talking on Thursday at 12 o'clock, okay? So it's a little bit different than Friday. And then now let's go right to that answer. Let's see, what do we got?
Oh, yes, most people are saying shelf life.
Really?
Increase the shelf life.
Yeah, it's a preservative. Yeah. Nitrates preserve the color, and they last things that you can sit on the shelf longer. So the meat will stay nice and red and pink,
We have
and it
very
won't turn
smart watchers.
gray. And so, hey guys, when you see that ingredient, get the alternative, which is celery juice powder instead of the nitrates, okay? A little healthier, a lot healthier.
Good.
Thanks for your calls, guys. You guys are great. Again, for those of you on the lab, stay tuned in the membership site. We're going to do another show, and we'll see you next week on Thursday at 12 o'clock. Have a great one.